welcome to the deep dive. Today, we're going to be taking a deep dive into a medical mystery. Out that this disease, while it's pretty rare these days, at least in developed countries,
Right.
it's got a pretty captivating story.
Yeah.
It's got ties to genetics and to poverty and to something that a lot of us have probably even encountered, strep throat.
Mm-hmm.
So we're going to be unpacking all that today, exploring the causes and the symptoms, and even going to touch on its connection to a historical figure and a unique skin rash. So by the end of this, you'll have a solid understanding of acute rheumatic fever and what makes it so intriguing.
Sounds really interesting. It's amazing how, sometimes a simple bacterial infection can actually trigger such a complex chain of events in the body.
Yeah, it really
Okay.
is. So let's just start with the basics. What exactly is acute rheumatic fever?
Okay, so acute rheumatic fever, or RAA, it's an inflammatory autoimmune disease.
Okay.
And what's interesting is that it's not actually the infection itself
Right.
that directly causes the problem.
Uh-huh.
It's triggered by the body's response to an untreated infection
Okay.
by group A streptococcus bacteria,
Okay.
which is the kind that causes strep throat. Imagine, your immune system is like an army
Right.
defending your body.
Right.
Usually it recognizes and attacks invaders like bacteria.
Uh-huh.
But in RAA, after fighting off strep throat, the immune system gets a little confused.
Okay.
And it starts seeing some of your own tissues as enemies because they resemble the strep bacteria.
Interesting.
So instead of protecting you, the immune system actually starts attacking you.
So that's when the problems begin.
Exactly, yeah. So it can attack your heart, your joints, even your skin, and even the brain.
Wow.
Yeah, it's kind of a big deal.
And historically, this condition has another name too, right?
It does, yeah. It's also known as Bouilleau's disease,
Okay.
after Jean-Baptiste Bouilleau, a French physician who lived in the 1800s.
Okay.
And he was actually one of the first to thoroughly describe the link between rheumatic fever and heart disease.
Interesting. So a little history lesson for us. So let's shift gears a little bit. Who's most at risk for developing RAA?
Well, primarily it affects children between 5 and 15 years old.
Okay.
And you rarely see it after the age of 25.
So it's a disease that primarily affects younger people. Is there any particular reason for that?
Well, that's still being studied,
Right.
but we know that children's immune systems are still developing and might be more prone to this kind of overreaction.
Okay.
But interestingly, it's also more common in females.
Really?
Yes.
Huh. And you had mentioned that poverty also plays a role.
It does, yeah. RAA is much more common in poorer populations.
Right.
And less so in, industrialized nations.
Okay.
And this difference is likely tied to healthcare access.
Here.
Because obviously, in places where people can easily get diagnosed and treated for strep throat,
Right.
it's less common.
Right. That makes sense. So early detection and treatment for strep throat really seem crucial in kind of preventing this cascade of events.
Exactly, yeah. But there's another piece to this puzzle: genetics.
Okay.
So certain genes, called HLA alleles, increase a person's susceptibility to RAA,
Okay.
and especially types DR2 and DR4. And ethnicity also kind of plays a role, with North Africa having a higher incidence rate.
So it's like a combination of factors.
It is, yeah.
Okay. So let's zoom in on the culprit itself.
Okay.
Group A streptococcus.
Yes.
What makes this bacteria so potent?
Well, this bacteria is quite complex, and it has a protein on its surface called protein M.
Okay.
And that's really the key to its virulence. You can think of it as like a weapon that the bacteria uses to evade your immune system and cause infection.
So protein M is the bad guy, basically.
You could say that, yeah.
Okay.
And remember that it's not the bacteria itself that directly causes RAA.
Right.
It's your body's immune response to this protein.
Okay.
That's what triggers the inflammation and the tissue damage. It's almost like friendly fire.
Yeah.
And actually, when we look at the hearts of people with RAA,
Mm-hmm.
we often find something called Aschoff nodules.
Aschoff nodules.
Yeah, and these are basically like clusters of inflammatory cells
Okay.
that form in the heart tissue.
So are those nodules a sign of like permanent damage?
They definitely indicate that inflammation is happening.
Right.
And while they can sometimes resolve, their presence can contribute to long-term heart complications.
Okay. So how does this actually manifest?
Right.
Like, what are the symptoms of RAA?
Well, this is where things get a little tricky.
Okay.
Because there's a silent period
Okay.
after the initial strep infection. So
So-
you might think you're in the clear,
Right.
but then about 2 to 3 weeks later,
Okay.
RAA symptoms can appear.
So it's kind of like a delayed reaction?
Exactly.
Like,
And the symptoms themselves are pretty diverse. So let's imagine a young girl, maybe 10 years old, living in a community where strep throat spreads really easily.
right.
So she gets a sore throat, maybe a little bit of fever, but it clears up on its own.
Okay.
Now, a few weeks later,
Yeah.
she starts experiencing new symptoms.
Like what kinds of symptoms?
Okay, well, she might develop a high fever again.
Okay.
She might feel really tired, maybe lose her appetite, even have some stomach pain.
Okay.
But one of the hallmark symptoms of RAA is something called polyarthritis.
Polyarthritis, what does that mean?
Well, it basically means her joints will become painful and swollen, especially the bigger ones like her elbows, wrists, knees, and ankles.
So like the major joints.
Exactly, yeah. And here's the strange part.
Okay.
It's fleeting.
What do you mean?
So, like, the pain might be in her knee one day and then her elbow the next.
Yeah.
Like, it's almost migrating through her body.
That sounds incredibly uncomfortable.
It is, yeah.
Are there any, like, visible signs? Like, on her skin or anything?
Sometimes, yeah. It's not that common.
Okay.
But RAA can actually cause a very specific rash called erythema marginatum.
Erythema marginatum.
Yeah, and it looks like kind of pinkish or brownish patches with a red border appearing mainly on the limbs and trunk, but never on the face.
Oh, interesting.
And it doesn't itch, which is helpful in distinguishing it from other rashes.
So if you see that very specific rash, it's a red flag.
Definitely something to pay attention to.
Okay.
Another less common sign is subcutaneous nodules, which are like small, firm lumps under the skin, usually near joints.
So we've got fever, joint pain, and sometimes a rash. Anything else?
There's one more symptom, and this one is probably the most concerning. And that's because it often appears much later, maybe even 2 to 6 months after the initial strep infection.
That's a long time.
It is, yeah, and it's called Sydenham's chorea.
Sydenham's chorea.
Yeah. And it affects the nervous system and can cause like a range of neurological and psychological issues.
Okay, this is all starting to sound pretty serious.
Yeah, it can be.
Yeah.
And this is just the beginning.
Oh, no.
We haven't even talked about the heart yet.
Okay.
Which is where RAA can cause the most serious long-term problems.
Well, let's dive into that in part 2.
Make sure you follow us on all social media platforms to stay updated. We hope you feel empowered to learn more. Stay curious, stay informed, and most importantly, stay well.
We're just talking about that young girl who developed some concerning symptoms a few weeks after a seemingly mild case of strep throat.
Right. You were just about to tell us about the impact on the heart.
Yes.
It sounds like that's where things can get really serious with RAA.
It is. It is. And remember how we talked about the immune system getting confused and attacking the body's own tissues?
Right.
Well, the heart is a prime target.
Okay.
And this is called rheumatic carditis, the inflammation of the heart. And it's a major concern with RAA.
So the heart's basically under attack by the body's own defenses.
Unfortunately, yes. And it's not just one part of the heart that's affected either.
Oh.
RAA can inflame all 3 layers. The pericardium, which is the outer sac surrounding the heart, the myocardium, the heart muscle itself, and the endocardium, the inner lining of the heart, including the valves.
Wow, so the whole heart is vulnerable. What happens when those layers become inflamed?
Well, it depends on the severity. Inflammation of the pericardium, called pericarditis, can cause chest pain and fluid buildup around the heart. Myocarditis, inflammation of the heart muscle, can weaken the heart's ability to pump blood effectively.
Oh, wow.
And endocarditis, inflammation of the heart valves, can damage the valves, leading to leaks or narrowing, which disrupts blood flow.
That sounds like those complications could have long-term consequences.
Absolutely. The heart valves are crucial for directing blood flow through the heart, and if they're damaged, it can lead to heart failure, stroke, and other serious problems down the line.
It sounds pretty serious.
It can be. That's why early diagnosis and treatment are so vital in preventing that lasting damage.
Okay, let's back up a bit. How do doctors even know if someone has RAA with all these varied symptoms?
It can be a bit of a puzzle, right?
Yeah.
Diagnosis involves a combination of things. First, the doctor will ask about the patient's medical history, especially any recent sore throats or fevers. Then they'll do a physical exam to check for those telltale signs we talked about. The fever, the swollen joints, that specific rash, and any unusual movements.
So they're looking for those clues, but is that enough to actually make a diagnosis?
Not always. Doctors also use specific criteria called the Jones criteria, named after Dr. Thomas Duckett Jones, who developed them back in the 1940s. These criteria help standardize the diagnosis of RAA by looking for a combination of major and minor criteria.
Can you give us some examples of those criteria?
Sure, so some major criteria include carditis, which we just discussed, polyarthritis, that migrating joint pain, Sydenham's chorea, erythema marginatum, the rash, and subcutaneous nodules. Minor criteria can include things like fever, elevated inflammatory markers in the blood, and evidence of a previous strep infection.
So it's not just one symptom, it's a pattern of symptoms that points to RAA. Do they do any lab tests to confirm?
Yes, lab tests are essential. They'll take a throat swab to see if group A strep is still present, although often it's gone by the time RAA symptoms appear.
Right.
They'll also do blood tests.
What are they looking for in the blood tests?
One key test checks for antibodies against strep bacteria, so even if the bacteria itself is gone, these antibodies will be elevated, showing the body recently fought off a strep infection. And they'll also check for markers of inflammation, like C-reactive protein or erythrocyte sedimentation rate. Elevated levels of these markers indicate an active inflammatory process in the body, further supporting the diagnosis of RAA.
So it's like piecing together a puzzle. The doctor considers the patient's history, looks for specific symptoms, and then confirms with those lab tests to get a clearer picture. What happens once RAA is diagnosed?
Then it's all about treatment. And the good news is RAA is treatable, but the key is catching it early and addressing both the root cause and the inflammatory response.
Okay, let's talk about that. What's the first line of defense?
Well, the first step is to eradicate any lingering strep bacteria, even if it's not actively causing symptoms anymore. This is usually done with penicillin, a common antibiotic.
Okay.
It's often given as a single injection of benzathine benzylpenicillin, which provides long-lasting protection.
So knock out the bacteria makes sense. But what if someone is allergic to penicillin?
There are alternatives. Thankfully, erythromycin, another antibiotic, can be taken orally for about 10 days and is also effective against strep.
Okay, good to know there are options. But RAA is more than just a bacterial infection, right? We talk about that whole inflammatory cascade going on.
You're absolutely right. Treating the inflammation is just as important as eliminating the bacteria. Rest is crucial, and doctors often prescribe corticosteroids, like prednisone. These medications work quickly to reduce inflammation and prevent further damage to the heart, joints, and other organs.
So it's a two-pronged approach.
Yeah.
Attack the infection and calm the immune system down.
Exactly. Now, if the heart is significantly involved, particularly if heart failure develops, additional medications might be needed.
Okay.
Things like diuretics to remove excess fluid, digoxin to strengthen heart contractions, and vasodilators to relax blood vessels and improve blood flow.
It sounds like the treatment gets pretty intense depending on the severity of the RAA.
It can. And for those experiencing Sydenham's chorea, antipsychotic medications like haloperidol can help manage those involuntary movements and behavioral changes.
So there's a whole range of treatments tailored to those specific symptoms. What about long-term damage? Can that be reversed?
That's a great question, and it's one of the biggest concerns with RAA. Some damage, especially to the heart valves, can be irreversible. Scarring and thickening of the valves can lead to ongoing problems with the blood flow, even after the initial inflammation subsides.
That's a reminder of how serious this seemingly simple strep infection can become if left untreated.
Absolutely. That's where early intervention is so crucial. In severe cases, surgery might even be necessary to repair or replace damaged heart valves.
Wow, that's a big deal.
Yeah,
So prevention seems like the best medicine here.
you're 100% right. Prompt treatment of strep throat is paramount. That's primary prevention. But for those who have already had RAA, especially those with carditis, secondary prevention is essential.
What does secondary prevention involve?
It usually involves long-term, low-dose antibiotics to prevent recurrences of strep throat.
Hmm.
It's all about protecting the heart from further damage and minimizing the risk of those long-term complications we talked about.
So once you've had RAA, you're kind of on guard for life.
In a way, yes, especially if there's been heart involvement. Regular checkups with a doctor are essential to monitor for any new symptoms and make sure the heart is functioning properly.
And this is where access to healthcare becomes a huge factor again, right?
Exactly. Making sure people have access to ongoing care and preventative measures is crucial in managing the long-term impact of RAA. It's not just about treating that initial episode, but about providing continuous support to prevent future problems.
I'm curious, what does that ongoing monitoring look like in practice?
Well, it usually involves regular clinical assessments. The doctor will check things like weight, blood pressure, and heart rate, looking for any subtle changes that might signal a problem. They'll also monitor for any potential side effects of the medications being used.
Side effects. What kind of side effects?
Well, long-term use of corticosteroids, while effective in reducing inflammation, can have some downsides. They can sometimes cause weight gain, mood changes, and weaken bones. In rare cases, they can also increase the risk of developing type 1 diabetes.
Right.
So it's about finding that balance between treating the condition and managing those potential medication side effects.
Sounds like a delicate balancing act. Are there any other monitoring tools that doctors use?
Yes, they'll also use something called paraclinical monitoring, which basically means tests.
Okay.
So blood tests can be done to check for signs of inflammation, like that elevated C-reactive protein we talked about earlier. And imaging tests like electrocardiograms, ECGs, and echocardiograms, EKOs, help monitor heart function and look for any structural changes.
Are these tests done frequently?
Well, the frequency depends on the individual case and the severity of the initial RAA episode.
Okay.
But generally, someone who's had RAA, especially with carditis, would have an echo at the beginning and end of their corticosteroid treatment, and then another one about 3 months later to check for any lasting damage.
So they're making sure the heart is healing as well as possible. What's the overall prognosis for someone with RAA? Is full recovery possible?
Well, the good news is that in about 80% of cases, the obvious symptoms of RAA disappear within 12 weeks.
Okay, that's good.
However, this doesn't mean the danger is completely gone. There's always a risk of recurrence, especially if there's another exposure to group A strep. And as we've discussed, the potential for long-term complications, especially heart valve damage, is a serious concern.
So it's almost like a shadow that lingers, even after that initial storm has passed.
That's a good way to put it. And unfortunately, in developing countries where access to healthcare is limited, the mortality rate from RAA can be as high as 1 to 10% each year.
Wow, that's a stark reminder of the global health disparities that we face.
It is.
So the long-term outlook really depends on a lot of factors.
It does. The severity of the initial heart involvement, the number of recurrences, ongoing access to healthcare, and adherence to preventative measures all play a role. And interestingly, the type of heart valve damage can also vary depending on age.
Ah,
Well, mitral valve involvement, which means the valve between the left atrium and left ventricle, tends to affect younger individuals more. Specifically, mitral insufficiency, where the valve doesn't close properly, is more common in younger patients, while rheumatic mitral stenosis, a narrowing of the valve, is more common in older patients.
so different ages, different types of heart issues.
Mhm.
Let's talk a little bit more about that rheumatic mitral stenosis, since you mentioned it's more common in older folks.
Sure, it's actually a fascinating process, albeit a concerning one. With rheumatic mitral stenosis, the damage to the valve happens gradually over decades. The leaflets of the valve thicken, the commissures, or the points where the leaflets join, fuse together, the chordae tendineae, the cords that support the valve, shorten, and over time, calcium deposits can build up, further restricting the valve's movement.
So it's a slow but progressive deterioration of the valve's function.
Precisely. And as the valve becomes more and more narrowed, it restricts blood flow from the left atrium to the left ventricle. This can lead to a buildup of pressure in the left atrium, which can eventually back up into the lungs, causing shortness of breath, fatigue, and other symptoms of heart failure.
That sounds really debilitating. Can anything be done to address that narrowing?
Well, lifestyle modifications like limiting salt intake and staying active can help manage symptoms. Medications like diuretics to reduce fluid buildup and beta blockers to slow the heart rate can also improve quality of life. But in cases of severe mitral stenosis, a surgical intervention might be necessary.
What kind of surgery are we talking about?
One option is a percutaneous mitral valvuloplasty, a minimally invasive procedure where a balloon is inserted through a catheter and inflated to widen the narrowed valve.
Okay.
It's not a cure, but it can significantly improve blood flow and relieve symptoms.
It's amazing what medical technology can do these days. But it also highlights how important it is to prevent RAA from happening in the first place, or at least to catch it early and prevent that long-term damage.
You're absolutely right. Early and complete treatment of strep throat really is the most effective way to prevent this potentially devastating disease. It sounds simple, but it's a message that can't be stressed enough.
Okay, so we've covered a lot of ground here. We've learned about the causes, symptoms, diagnosis, treatment, and even the long-term consequences of RAA. It's been quite a journey.
It has. And I think it's important to remember that while RAA is less common in developed countries, it still poses a significant threat to global health, particularly in regions with limited access to healthcare.
Right, and even in places with good health care, it's a reminder that a seemingly simple infection can have far-reaching consequences if not addressed promptly. But before we wrap up, I'd love to hear your final thoughts on this.
Make sure you follow us on all social media platforms to stay updated. We hope you feel empowered to learn more. Stay curious, stay informed, and most importantly, stay well.
Wow, we've really been on quite a journey exploring this acute rheumatic fever, huh?
It's fascinating and also a little bit alarming, I have to say, to see how a common illness like strep throat can actually lead to such serious complications.
It is. It really highlights, how interconnected our bodies are
Yeah.
and how a seemingly simple infection can cascade into something, far more complex.
Yeah, definitely. So let's recap, I guess, the key takeaways
Okay.
for our listener here and make sure we tie everything together.
Sounds good. So first, just remember that RAA is an inflammatory autoimmune disease.
Right.
It's not directly caused by that group A strep infection itself, but
Right.
rather, like we said, by the body's immune response to it.
And that immune response can be pretty dramatic.
It can, yeah.
Right.
It's like the immune system goes into overdrive
Yeah.
and starts attacking the body's own tissues.
Right, like an overzealous army.
Exactly. Yeah, especially in the heart, the joints, the skin, and even the brain.
Yeah, and the symptoms can be very
Yeah.
and sometimes appear weeks after that initial strep throat, which makes it even trickier to diagnose.
Exactly.
Right. We talked about those symptoms.
Right.
Ranging from, fever and joint pain
Right.
to that distinctive rash, erythema marginatum,
Yes.
and even neurological problems like Sydenham's chorea.
Exactly. A lot of different ways it can manifest.
Yeah. And we can't forget about the heart.
Right.
Rheumatic carditis,
Yes.
the inflammation of the heart.
It's a big one.
It's a major concern with RAA
Yeah.
because it can damage those heart valves
That's right.
and lead to long-term problems with blood flow.
Exactly.
So early diagnosis is critical.
Absolutely.
And we discussed how doctors use a combination of factors, right,
Yeah.
to diagnose REA, including the patient's history,
Right.
the physical exam,
Mm-hmm.
those specific criteria called the Jones criteria.
Yep.
And then, of course, lab tests to confirm the presence of strep antibodies
Yes.
and inflammation.
Absolutely.
And then, once diagnosed, treatment focuses on eliminating any lingering strep bacteria
Right.
with antibiotics,
Yeah.
usually penicillin,
Yeah.
and managing the inflammation with medications like corticosteroids.
Exactly.
And then for people who've already had RAA,
Right.
especially those with heart involvement,
Mm-hmm.
secondary prevention
Mm-hmm.
with long-term low-dose antibiotics
Yeah.
is crucial
It is, yeah.
to prevent those recurrences
Right.
and protect the heart from further damage. And then that ongoing monitoring and care is so important.
It is,
Right. Regular checkups, blood tests to track inflammation,
Mm-hmm.
imaging tests like echocardiograms
Yeah.
to monitor that heart function.
Absolutely.
All those things can make a big difference in preventing those complications down the line.
They really can. It's interesting. Throughout this whole deep dive,
Mhm.
what's really struck me is that link between RAA and poverty.
Yes.
We talked about how access to healthcare
Mm-hmm.
and timely treatment for strep throat
Right.
is such a huge role in
Yeah.
preventing this disease. A reminder that social and economic factors are very much intertwined with health outcomes.
Absolutely.
In many parts of the world, RAA is still prevalent
Yeah.
precisely because people lack access to, basic health care, including antibiotics.
It's really disheartening to think that, a disease that's largely preventable with timely intervention
Right.
still continues to affect so many lives
Yeah.
just because of these systemic inequalities.
Absolutely. It's a complex issue for sure,
Yeah.
but awareness is definitely a crucial first step.
Right.
Understanding the link between strep throat and RAA, recognizing the symptoms, and advocating for that access to healthcare.
Yeah.
Those are all so vital in the fight against this disease.
Well, this definitely given me, I guess, a new appreciation
Good.
for those, I guess you could call them ripple effects
Yeah.
of what can seem like a simple sore throat.
Right.
Yeah, it's given me a lot to think about in terms of health equity
Mm.
and the importance of, global access to healthcare.
It's a big one.
Absolutely. Well, thank you so much for joining me on this deep dive.
It was my pleasure.
It's been truly enlightening. And a big thanks to our listener for sharing this fascinating and important topic with us. Until next time, keep exploring, keep learning.
Make sure you follow us on all social media platforms to stay updated. We hope you feel empowered to learn more. Stay curious, stay informed, and most importantly, stay well.